mynews.studio.
A single injection every 2 months could change the landscape of HIV prevention worldwide. But the big question is, will it actually reach the people who need it most?
Today's date is 2025-727. The World Health Organization has, for the first time, recommended a long-acting injectable for HIV prevention. That's Cabotegravir, right?
Exactly. Cabotegravir is a long-acting antiretroviral given by injection every 2 months. Clinical trials show it's highly effective at preventing HIV infection, especially among people at higher risk. The WHO's recommendation is a major signal. It tells countries and funders that this should be a priority now.
Why make this move now? And how is it different from daily PrEP pills?
Daily oral PrEP, usually that's tenofovir plus emtricitabine, does work well. But there's a big issue: adherence. People sometimes struggle to take a pill every day. That could be due to stigma, privacy worries, or just forgetting. Cabotegravir gets around that. Instead of a daily pill, it's just 6 injections a year.
So how soon could it actually reach people most at risk, like in sub-Saharan Africa?
That's really the key issue. Access is still a big hurdle. The developer, ViiV Healthcare, has licensed Cabotegravir to the medicines patent pool. That means some manufacturers can start working on generics, but those probably won't be available until at least 2027. Meanwhile, the branded version is expensive and supply is limited, so cost and availability are current challenges.
Are there any moves to make it more affordable before generics are out?
Yes, international donors like the Global Fund and PEPFAR are stepping in to help with procurement. Also, WHO is recommending rapid HIV testing and delivering the injections outside of hospitals, so at community clinics or even pharmacies. That could bring down costs and make it logistically simpler.
But will people actually use it? There's sometimes a gap between what's recommended and what happens in real life.
That's true. Uptake depends on a few things: awareness, trust, and reducing stigma. Many at-risk groups like sex workers, young people, or men who have sex with men often face discrimination in healthcare. A discreet, long-acting option could help, but only if services are easy to reach, culturally appropriate, and led by the community itself.
What lessons are there from oral PrEP? Any takeaways that could guide the rollout of Cabotegravir?
Choice really matters. Oral PrEP uptake was slow in some places because people didn't know about it. Clinics were too far, or they worried about being seen getting HIV meds. Programs that succeeded offered auctions, brought services closer to people, and used rapid or self-testing. The same strategies could help make Cabotegravir more accessible.
Are there any risks or downsides with the injection?
There are a few. Some people may get reactions where they're injected, and regular HIV testing is still needed. If someone gets HIV while on Cabotegravir, catching it early is important because resistance can develop. So, ongoing monitoring and support matter a lot.
Looking at the bigger picture, could this change the course of the HIV epidemic?
There's definite potential. If enough people at high risk can access and use Cabotegravir, especially in places with high rates of new HIV infections, we could see those numbers drop significantly. But it all depends on fair access. Otherwise, the divide between wealthier and poorer countries could actually get worse.
So just to sum up, WHO now recommends Cabotegravir as the first long-acting injectable for HIV prevention. But access, affordability, and community involvement are the main challenges. If those are handled, this could be a turning point.
That's it. It's a scientific step forward, but how it's put into practice will really determine the impact. The next few years are going to be crucial.
Which brings us back to the opening question. Will this shot actually reach the people who need it most, and how soon will that happen?
Thanks for joining us as we unpacked what this new HIV prevention option could mean for global health and what it'll take to make it effective.
Thank you for listening. This episode was brought to you by mynews.studio. Try it out for free.